He will not force over
I'm not sure David really needs any introduction at all, but for completeness, I pulled out his bio. Well, first of all, David is a close friend, and I probably reserve some of what I'm going to say for his proper retirement, which is on the 10th of November. So pencil it in your diary. It's going to be a great do at Balliol. But I'll just say one thing. When I came to look at the job here, David kindly took me out for dinner, and I was in Sheffield at the time, and Sheffield winters can be pretty rough and cold. And I asked David, "What's the weather like in Oxford?" And he said, "It never snows." And I was very, very reassured. And the 3 following winters after we arrived, I was snowed in. So thank you, David, for the good advice. So David trained in Bristol, and he came to Oxford quite a long time ago, 1983, to do renal transplantation. So if anybody knew that, and he was working with Peter Morris. He did his DPhil, Catherine Wood, I think, and then he did a lecturer post in urology and transplantation and was appointed as consultant in 1991. His main interest, as you all know, is renal cancer, urological complications of transplantation, and he, 1992, as soon as he came, he got together with Adrian Harris, and they built a very solid platform of research where many MD, PhD students went through and have eminent positions everywhere, including the currently elected president of BAUS, Tim O'Brien. Then he took a particular interest in minimally invasive intervention and HIFU in particular, been instrumental in getting CE marking for the first machine in Europe here. There's more to come. We're expecting a new machine, and we're going to do with him the same work of getting CE marking. Investigating all the various mechanisms and connecting people together and doing excellent work. Every time I walk with David somewhere public, and he says, "I know this guy," I immediately think that guy has either one kidney or one testicle. The final thing to say is that he's become over the years our urological and medical historian, and he's now got 3 books to his credit and continues to write more. So thanks for doing that today.
Thanks, Freddie, and Freddie never believes anything I say now after the snow episode. So, firstly, acknowledgements, because most of what I say has been taken from these 3 books, which actually are fascinating. And if you're interested in it, recommend it to you. So, medicine and art, and of course, in the days before photography, art was an important way of just putting medical things together and drawing things, painting things, sketching things, and it still is to some extent today. So if we go back probably nearly 4,000, 5,000 years, Imhotep, William Osler said when he visited Egypt in World War I, this was the first figure of a physician to stand out clearly from the mists of antiquity. Identified by some as the god of medicine by the Greeks, and the healing god Asclepius by the Romans. And he was physician to the pharaohs, one of the pharaohs in Egypt. And then, of course, Hippocrates, and still today in some of the universities, the Hippocratic Oath is taken when people take their finals, as a ethical and moral standard done many, many years ago. So he was born on Kos and is widely regarded as the father of modern medicine. And that is a Roman coin with his head on it, which is in the British Museum. And on the left, patient being dressed after bleeding, which was done in those days. And then, of course, across the world, the Ayurvedic practitioner, which basically they're still around today, and that medicine is practiced, a holistic type of medicine, looking at the whole body rather than just one portion of it. And here's a painting from Delhi in about 1830, which is in the Wellcome Library, of a physician taking the pulse. It's interesting because if you actually look at where his hand is and where the patient's hand is, it's not really feeling for the radial pulse. But that was a painting by an unknown artist in Delhi. And this is a very famous painting which is well known amongst transplant surgeons. Cosmas and Damien were very well-known physicians in the 3rd century. And this is a painting from 1495 of them performing a cure, putting a leg from a coloured man onto a white man's leg, probably having removed it for some tumour or other. And then, of course, in the 1,000 years ago, a lot of the medicine was done by the church and the nuns and the physicians, and this is St. Humility on the right-hand side here. So she was married for 9 years, and then with her husband's consent, so I'm not quite sure how the marriage was working out, he agreed that she should enter a convent, and she became a saint, and she's wearing a sort of hat made of sheepskin, which is meant to illustrate her gentleness and her humility. And apparently here is a physician looking at a bowl full of blood, so the question is whether the patient may have had tuberculosis and was coughing up blood and sputum. And here's again St. Francis healing a leper with the shoulder, obviously in certain pain from the shoulder, and hoping for miraculous healing of this leper. So there were a lot of quack doctors around, as is this guy here underneath the umbrella. And if you look at this more carefully, those who are experts in art say that here's a hunter who's looking at this and perhaps quite taken with this medicine. Here's a woman who's looking on rather more skeptically. Here's a lady who's cleaning the bottom of her child, and some of the people say, well, maybe that's just totally ignoring this physician and saying what a quack he is. And here's a young boy who's trying to catch this bird, and they talk about the fact that some cures are unobtainable, just like that bird's probably just about to fly away. So William Harvey was in Oxford. He was actually one of the wardens of Merton College, and he was the physician to Charles I and James before him. And here he is demonstrating his circulation of the blood before the king. And he managed to survive after the king was executed, and managed to escape with, well, in fact, more than escape. He was still around, even though he was very loyal to the king. He was not imprisoned or taken in any way, And here's the very famous picture by an unknown artist from his book on the motion of the heart. And like many things in medicine and surgery, initially it wasn't believed, and it took a while for it to become generally accepted. So across the world, of course, here's Chinese manipulating shoulder pain in the late 1800s. And of course, Chinese medicine is very well known, goes back into antiquity, and it's still today, the work that we're doing with China in terms of high-intensity focus ultrasound is amongst the best in the world, if not better than most in the world. So in North America, the medicine man curing the patient here lying sick, and here we are rattling gourds and various other instruments trying to create healing of that. And this also is in the Wellcome Library in London. This is a famous painting by David Teniers the Younger, The Village Doctor. So here's a uroscopy looking at the urine. People sort of poo-poo it, but of course the urine is quite useful if there's blood in it. You can see what's going on. And I remember when Joe Smith, my senior colleague, was teaching me, he said, if you can read the Times, and I think it probably had to be the Times, through a bottle of urine, then the patient did not have a urinary infection. But John Radcliffe, there's a story of a lady who brought some urine to John Radcliffe and asked him to diagnose his her husband's illness. And he said, well, where's your husband? He said, he's 4 miles away. And what does he do? He's a bootmaker. So he went into the back room, emptied out the urine, put his own urine into the flask and gave it to the lady and said, take this to your husband. If he can make me a pair of boots by looking at my urine, then I'll diagnose his complaint by looking at his. So he didn't think much of that. And of course, there's the story of testing for diabetes by just putting your finger in it and tasting it. And not so long ago, I think, to new medical students, somebody got some urine and quickly dipped their third finger in and licked their second and then gave it to the student to say, now you taste it and see, and did it so quickly that they didn't see which finger he actually put in his mouth. So I think the student did actually have a taste of the urine. So Edward Jenner, of course, started vaccination. Here's a picture in 1807, and vaccination started in the late 1700s. And again, another thing which was very sceptical. There is the story that 20 years before Jenner started doing it, there was a farmer who injected cowpox into his family to stop them getting smallpox. But apparently Jenner took an 8-year-old boy and injected him with cowpox, and then a few weeks later injected him with smallpox, which I'm sure would certainly not pass ethical approval these days, but that's what he did. But again, because of it took a while for it to become accepted, although it did within a few years. But here's a cartoon of the effects of the new inoculation painted in 1802, and you can see here the idea that, if you're going to do it with cowpox, you're going to get cows coming out of your nose and your arm. Infections and so on were subject of painting and sketching. This is taken from the Ancient Mariner, but this is entitled Water, Water Everywhere and Not a Drop to Drink, as cholera came. And the cholera outbreak of 1848 and 49, there was a Public Health Act to organise the water supply, so people were stopped from drinking the water that was around and had to take it from certain places, which meant that at times there was quite a lot that they couldn't drink. And there's a painting, again, the artist is unknown, but a very poignant painting of before and after cholera of a young Venetian woman at the age of 23. So Albucasis was one of the most famous, or the most famous Arabian surgeon around the 1100s, and has written a classic book on medicine and treatment of medicine. And here he is blistering a patient in front of two of his trainees, which they used to do for the cure of certain things, or the apparent cure of certain things. And Vesalius was a very famous anatomist. And these were some of the paintings of his book, which is extremely well known, in 1543, of the muscle man on the left and the skeleton on the right, in the treatment of diseases, in the understanding of anatomy. And of course, Leonardo da Vinci is extremely well known for many, many things, but of course also for his wonderful drawings, many of which I think are in the Queen's collection at Windsor. So this is 1510, his anatomy, looking at the larynx and also the leg. And this, if you go into Freddie's office, you'll see a picture of this hanging up. Very famous painting by Rembrandt called The Anatomy Lesson of Dr. Tulp, where he's just showing the students the dissection, looking at the muscles of the forearm and the tendons there. That's a picture which is in the museum in The Hague. So John and William Hunter were very famous, of course, the Hunterian Museum at the Royal College of Surgeons. And this is a picture of their dissecting room in Great Windmill Street in London. And a very interesting house, that, because where they used to do this, there was the front of the house, which was in a very high quality area, but the back of it was much more salubrious. And of course, this was in the days where you got bodies from digging them up in the graveyard. And apparently here on the right-hand side are the prices that people would be given for a body of a man or a woman or a child. And they used to be brought in through the back doors for the dissecting room in the house. And but all the sort of great and the good would come in the front door of the house. And here's a lecture later on at the Hunterian School of Anatomy in London, with pictures not only of human anatomy but of various animals as well there. There aren't a huge number of paintings of students and studying, but this is one of a student studying in the 1860s while presumably his wife is busy mending clothes and sitting at his desk doing that. And this is Charcot, actually, as in Charcot's joints, giving a clinical lesson there. One of the grand rounds. So here's a lady who's brought in who is fainting, possibly at the sight of all the guys there, but whatever's wrong with her. And then she's a nurse standing behind to look after her, somebody to support her. And I'm sure many of us remember the grand rounds where you did actually have patients brought in who were sitting in front And indeed here, when I started, we had patients coming into the front to talk about their illnesses and to be who would be just asked about their different diseases and the problems that were going on with them. This apparently is Charcot's son here sitting at the back there, and one or two other famous surgeons there. And again, another painting of these students or junior doctors watching while this boy who's got croup is having intubation, so with his mother or a nurse holding him and somebody holding his head as they're intubating him for his croup. And here in the late 1800s, again, here's the mother, here's a child who's being demonstrated to the surrounding either students or junior physicians. And here's another mother with her baby waiting at the back, so that after he's finished teaching on this child, then the next one comes along to be taught on. And this is a more recent painting in Florida, but the idea that the anatomy helps the surgeons and the physicians, the place where death delights to help the living, which is quite a poignant picture. This is a painting, although it's in New York, it's actually of Camden in London. And here's a mother cradling a child, where the physician or the apothecary is getting some medicine ready. Here's the person who's writing out the bill for her, and you can see that she's not particularly hopeful of the result in the days when the mortality rate was 150 deaths per 1,000 children. So, and of course in the days before antibiotics and antiseptics, so in the late probably 18 or mid-1800s. And this, another famous one, the sentence of death. So here's the physician who is telling him that he's got an incurable disease. The person the patient actually was a friend of the artist. Presumably he got him to sit for him. And the question, it's unknown exactly what the diagnosis was, but again, certainly before antibiotics. And the suggestion with the microscope on the desk is that maybe he had tuberculosis, maybe he had syphilis, or maybe it was a malignant and incurable condition, although he doesn't look as if he's got metastatic cancer. But the darkness of the room and the very poignant face of the person who's just been told that he hasn't got long to live. Lowry, of course, is a very famous artist, never married, lived with his parents, and painted the scenes around Manchester. And this is an outpatient hall in the 1950s, where apparently they just sat on lines in a queue, and one was called in after another as they sort of slowly moved up the benches. And the idea of them sitting and chatting to each other, getting to know each other, perhaps finding out a little bit about their each other's illnesses and why they were there. And of course that was in the days just after antibiotics had come in, so the idea that there's perhaps hope in some of those faces. And this was one by Van Gogh. Van Gogh, as you know, was mentally ill, and this was a hospital where he spent some of his time in Arles, a picture that lives in Switzerland now. And they talk about the separate cubicles here, sort of shrouded off by the curtains, but also the people just standing around, not particularly engaged in each other, all lost in their own dreams to some extent. And this is in London in the smallpox outbreak in the late 1800s. And so they housed this hospital in a tented camp in Finchley, just to keep away from the other people and just to keep the smallpox out. Smallpox was finally eradicated in about 30 years ago, I think. And this looks pretty gruesome, although it's apparently after an artist who painted this with a series of travelling players who were just demonstrating this in one of their plays as to how they did it. And here's a guy who's either pointing to his tooth or maybe he wants some medicine for the tooth. But if that was painted as a play, it's quite real. And here's another one where the dentist holds this key, which is behind his back, away from the patient. This is what he's going to use to pull the tooth out, but he hides it behind his back to conceal it from the patient so that she doesn't get too worried, and then presumably he produces it fairly quickly and just whips the tooth out. And of course, bloodletting was very well known, important from the early days. The idea that there were these humours in the bodies that you had to, if you released the blood, then it would let some of the humours out and they'd get better. Whereas actually a lot of them presumably got quite a lot worse, having lost quite a bit of blood. And here's the boy just collecting the blood underneath from the arm as it's bled. John Radcliffe, interestingly, disapproved of bleeding, but nevertheless, when he was ill in his final days, he allowed himself to be bled with, I don't think, any benefit at all. And here's a surgeon just binding up an arm after bloodletting. She doesn't look as if she's lost too much. This is a very famous painting which hangs in the Tate. It was commissioned by Tate himself. And it's extremely famous both in this country but also in America. The Americans made it into a stamp in 1947, and about 1 million prints of this was sold in the United States. The artist went down to Devon, and he actually looked at a cottage in Devon, and he constructed the room of the cottage in his studio to paint this. And he lost his own child on Christmas Day, and I think it's sort of symbolic of that. And here's the doctor who can't do very much more, is just watching in the background. You can't see them, but there's the husband there, and the wife is meant to be there cradling her head in her arms. And they suggest that they've been watching through the night, and this is the morning light just coming in, having done all that he can, just waiting and hoping that this child is going to recover. And certainly it's another picture of a very caring doctor who's stayed with the family through the night, waiting and watching to see what will happen to this child. And here's another one. This, interesting, is painted by Picasso when he was 16 years old. And this, he got his father to model the doctor, so that's Picasso's father. This child was borrowed from a beggar woman, apparently, and he borrowed the nun's habit and set this up to paint this picture. So here's the doctor again feeling the pulse, just to see how sick or well this patient is. And that's a lovely picture of a doctor trying to get the confidence of this little girl by listening to her doll which I'm sure is still done today in paediatric wards. And she still seems a little bit sceptical as to whether he's actually going to do much for the doll. But he was from Vermont, and that apparently is a Vermont certificate at the background. Family doctor whose life was in his work and in his medicine. That's a very famous picture which hangs in the library of the Johns Hopkins. It was actually painted in London by John Singer Sargent after Osler. Here's Osler, moved to Oxford as the Regius Professor of Medicine here, and then these others came over. So here's Welsh, pathologist, Halstead, the surgeon, Kelly, gynecologist, and Osler. So they came over and sat for this in London. And this big globe, apparently, initially, Singer Sargent couldn't get into the room and had to remove a bit of it to actually get it into the room. And this is in the United States again. Doctor in probably 1700s arrives on horseback with his bag and physician. And this lady, Grandma Moses, there is a Grandma Moses Day in the United States, apparently. She lived to 101, died, I think, in the 1970s, but when she started painting, she put her pictures up in the local village and was spotted by somebody and became very famous after that, and some of the presidents asked her to paint for them. But this is just a rural scene in the US, probably in about the 1700s, with the visit of the local doctor to the family. And of course, mental illness was a subject of a lot of paintings, and the very poignant features on this man, said to be acute dementia. And here, again, Sir Charles Bell. I'll talk a little bit about Sir Charles Bell in a minute. He was a surgeon and was very famous. But here he's a sketch of this madman, and this is what he's talking about. The body strong, muscles rigid, skin bound, features sharp, eyes sunk, colour a dark brown yellow, hair sooty back, chained up. And here's another one. So James Norris was a patient at Bethlehem Hospital in London, shortened to Bedlam. And this person, a chap called Edward Wakefield, brought this man to the notice of the public. They were often, you see how his neck's chained, arms chained, feet chained. And bringing this guy to the attention of the public contributed to 1815 House of Commons Select Committee on madhouses to change the way in which they were treated. And that, of course, is the first use of ether in dental surgery. Morton was I think he was a dentist. They used nitrous oxide first, and the way they discovered nitrous oxide was that he was sitting watching a sort of play, and these people were standing up and using this laughing gas, and the person next to him got up and went up on stage, had some of the laughing gas, was jumping around and smashed his knee on a table and came back and sat down, and Morton noticed that it was very cut and bleeding away and said, "That must hurt." The chap said, no, it doesn't hurt at all. And that's how he thought, well, there's something in this. So he started using nitrous oxide, and then this was the demonstration of ether. And again, like a lot of these other things, actually, it took a while to catch on, and I think one or two of the demonstrations didn't go very well. But of course, before long, it was, of course, fantastic use. So, but that's only what... less than 200 years ago. And that, of course, know what that is? penicillin, yeah, so that's penicillin. Valerie Petz did that for me for the book on penicillin. So, of course, that, although Fleming was said to have discovered it in 1928, there were suggestions of it being used before, and it was Florey and Heatley and Chain in Oxford in 1940 who made that available for the general public. So if you wanted to learn surgery, they said you go to war in those days. This is Ambrose Paré, or the father of modern surgery. This is the introduction to his book, where you can see it talks about the various injuries that you get from battle in this person. And here he is, a picture by Board in 1912, amputating in 1552 a leg, using a ligature there. And they used to use tar and cautery for sealing the stump, and on one occasion he ran out of that. So he used something much softer, egg white and rose oil, and he also used ligatures for sealing the vessels, and found that his patients did very much better than when they used burning tar and burning oil. So he, in a sense, it was sort of one of the early clinical trials, although it was just serendipitous that he hadn't got what he usually used and used something else, and found that it worked much better. He used the phrase often, I dressed him, but God healed him. And he was an extraordinary surgeon. This is very interesting. This is when Nelson lost his arm at Tenerife, and it's worth just reading this to you. So this is what happened. So they said that Nelson, leading from the front, clambered onto the mole. That was the breakwater, jutting out from the port. And as soon as he was struggling onto the jetty, he was hit, probably by a lead musket ball in the right arm just above the elbow. The humerus was shattered, and the brachial artery was bleeding profusely. Nelson's accompanying stepson, Josiah Nisbet, stripped off his silk sock, and after tying it and a second one tightly round the arm above the wound, took Nelson's bicorn hat and covered the injured part to hide the blood loss from the wounded admiral. Nelson refused the cutter to be rowed to the nearest ship, which was the frigate Seahorse, where the wife of Captain Fremantle, who'd been wounded in the landing, was on board, perhaps being less happy with the ship's surgeon, and he moved to the Theseus. Refusing assistance with his 3 limbs, he clambered up the tumble home, presumably that's the netting, and straightway ordered the ship's surgeons to prepare for his surgery. He bore the 15-minute high above elbow amputation calmly. His only complaint was that the instruments were cold. He disliked the sensation and ordered all squadron surgeons to warm their instruments before using them. When asked what was to be done with the severed arm, he told the surgeons to throw it into the weighted hammock alongside the corpse of a dead sailor who had bravely died of wounds after the assault on the breakwater. Receiving only 3 doses of laudanum, opium, after the surgery, he became understandably gloomy. He also became constipated after the analgesics. The surgery was for several months complicated by considerable stump pain. A branch of the median nerve had almost certainly been included in the arterial ligature. Repeated expenditure and medical consultations failed to alleviate the pains. Suddenly, on the 4th of December 1797, the ligature, after remaining stubbornly protruding from the wound, came away, and Nelson was free from his torment. So that's... and here's another picture of somebody who didn't take his amputation quite so calmly. So Charles Bell, we've seen one of his already. He was a surgeon and artist, like one or two other people, and he was present at Waterloo in 1815. Some people didn't think he was that good as a surgeon. Apparently he had a 90% mortality from his amputations, and one of his juniors wasn't terribly impressed with that. But here are some of the watercolors that he did, and I thought I'd keep this to the end. I assume that you'd probably finished your donuts by now. So you can see this patient with a gunshot wound to his upper thigh, died of hemorrhage, and here in days when bloodletting still went on, he said it's of the greatest moment to save blood. Here's a picture after Waterloo, which is in the National Army Museum in London. Not sure who painted that. What's that? So that's probably his most famous painting of tetanus with the rigid spasms of the back muscles of somebody who had gunshot wounds and to the skull, I think, and then subsequently died. There were one or two patients that he had who did actually survive tetanus. Here's another one with an old fracture on the shaft of the humerus with chronic sepsis and chronic pain 2 years after being shot. Here's a bullet wound of the skull which caused a depressed fracture, and because of the nature of that, they think the bullet was probably almost spent by the time it hit the skull, and apparently this guy made a full recovery when they just lifted up the skull. Here's somebody who had a saber cut to his head almost, and the dura was coming out of there. You could see the brain there, but apparently he made a full recovery too. And this was a guy who had his upper arm taken off by a cannonball, despite which he apparently rode 15 miles on a horse to a hospital and then fainted and was unconscious for 30 minutes. And apparently he made a full recovery. This was another cannonball injury to the upper arm at Waterloo. And another cannonball injury which took the part of the chest off. He apparently recovered from that. A sabre wound to the abdomen with bowel that then became gangrenous and he died. And here's a very famous picture again in the National Portrait Gallery in London. Here's Florence Nightingale at the receiving wounded in the Crimea War. And when she arrived, the mortality rate was about 50%, and she, by her nursing and what she did, got it down considerably. She was known, of course, as we know, as the Lady of the Lamp. She tried to make it her aim that no wounded soldier ever died alone, either looked after by her or one of her nurses on his deathbed. And then 1914, just over 100 years ago, here's the first wounded coming in. Interesting, here's a man smoking a pipe next to a patient reading the paper. Physician up here with, hardly see, but physician there with his nurses just going around in these long Nightingale wards, and I'm sure some of us remember that. When I was a houseman at Whipps Cross in London, we had these long Nightingale wards. I remember one occasion when there was a man there who just had a myocardial infarct a couple of days before, and there was a 15-year-old boy there who seemed to be recovering quite well from, maybe he'd had appendicitis, I'm not quite sure, but he was annoying this man so much that the nurses came and found, on one occasion we were on the first floor, this patient had had an MI 3 days before, holding this 15-year-old by the legs over the balcony, saying, "If you don't shut up, I'll drop you." Here's an advanced dressing station in France. Henry Tonks was another surgeon who worked with Treves, Frederick Treves, who was the man who delayed Edward VII's coronation because of an appendix abscess, and was famous for looking after the Elephant Man. And Tonks worked with Treves, and this was his advanced dressing station in France in 1918, with sort of chaos, but also the compassion of people caring for the wounded soldiers. Stretcher bearers taking a man out of the trenches with his injured head, and an advanced dressing station on the Western Front. But I thought I'd just finish with a more pleasant one. So this is Roy Kahn, of course many of us know, Professor of Surgery in Cambridge, who looked after a chap called Bellamy, who was an artist who had liver failure, and it was Bellamy who was teaching Roy Kahn and told him to use more vivid colours. And if you go to the transplant unit, there's a picture of Peter Morris done by Roy Kahn up in the transplant unit. So this is his compassion of the intensive care sister. So again, with grateful thanks to those three books, most of whom this is taken from, but a little trip through art and medicine.